Hi, I am Dr. Prashanth Acharya, Medical Director, Earth Ayurveda, Indranagar, Bangalore. Slip disc is the most common word, or still commoner is backache, neck pain, stiffness of the back. Tell me how many persons have not heard of it, but I say that every person in the world has gone through a backache or a neck pain or a back pain at least once in their lifetime. So they would have certainly experienced it for so many reasons. It might be due to long traveling, falling down, accident, or even physiologically like pregnancy. Anything can be done. It's backache. But one of the primary or main cause what we see today for the slip disc or for the backache is slip disc. Slipped disc is a common terminology used for a technical term called degenerative intravertebral disorder, IVDP, intravertebral disc disease or disc prolapse is what we call it as. What am I talking about? Disc. Let me just take a few seconds to tell you about it. This is the prototype of our spine, wherein you can see it is like a spring which has 33 bones in it, 5 cervical, the neck, 12 it's the mid back, and the lower 5 is the lower spine or lumbar spine, what we call it as, and the 5 united here we call it as a sacral bone, which is all united bone, 5 bones united together, and the rest is the coccyx, which is more cartilaginous in structure, and together with these hip bones it forms the total hip. All these yellow things what we are doing, we can think that these are the nerve roots coming out, wherein this is the main spinal cord, what it is coming over here. The red thing what we are seeing here is the blood supply. So generally what happens in this, if we see any two bones here, the light soft things what you see here is the soft spongy tissue which is called as a disc, which acts as a cushion in the whole spring sort of alignment of these all bones. Whenever there is an impact, movement, anything, this works as a cushion. This works, it takes all the pressure in it. So what happens in this? Due to various reasons or bad roads, you are driving on it, someone called you from behind, sudden there is a jerk, anything it might be. This disc is prone to swell, rupture and the slightly disc material coming out, or there is a big tear and all the disc material comes out. It can be in one place or in multiple places. The most common what it happens in the lower back is this, that is L5 S1, L4 L5 and L3 L4. These are the commonest places where it happens in the low back. Similarly, C5, C6, C6, C7 and C7 and T1 is the junction where it happens in the neck. When it happens in the low back, it might present as a low back and following to the leg as sciatica. But if it happens in the neck, it can happen in the neck and the radiating pain towards the hand, even the fingers. This can be intermittent, temporary and might go off, or it might be chronic, or it might be nagging and makes the person incapable of doing any other thing. The best investigation to do in this is an MRI of the affected place, generally associated with the whole spine screening, which makes it black and white. What's the extent it has happened. At that junction, I would recommend the best of the best treatment, Ayurveda Panchakarma. Of course, that's my PhD on, wherein I assess the situation, and depending on the situation, from 7 days to 42 days, I take up this treatment, which involves Katibasti, Grivabasti, Nadi Sveda, Abhyanga, Patrapinda and Matrabasti. Sometimes Katidhara or Grivadhara also are taken if it is required. And many a times I use Chandanabala Lakshadi Taila or Amrutadi Taila, which is done the paka called as Gandhaka Paka. And this preparation is mainly used to see that the swelling is reduced, which is presenting. If this is the nerve and this is a swelling which is pressed, once we do that, the pressure is released by shrinking the swelling what has happened. And once the pressure is relieved, subjectively or symptomatically, the pain is reduced and the person will come back to almost normalcy. The follow-up is again done with some Bhradva Chintamani and the Shalaki compounds, etc., etc. And mainly to strengthen the back, the oil Chandanabala Lakshadi Taila or Amrutadi Taila Gandhaka Paka is given to apply it on their back after indirectly warming it regularly, maybe ranging from 3 months. Sometimes I have given from 12 months to 16 months also, depending on the intensity. If they follow this particularly along with some light exercises like yoga or walking or swimming, they show extremely good results. And most of the persons who come to me with their appointments already fixed for surgery, 99% of them have foregone surgery, resorted to this particular treatment and have done very well. Thank you.